Board of Commissioner regular agenda session. At this time, I will call for Commissioner Michael Booth for the invocation and pledge.
Thank you, Madam Acting Chair. Would bow your heads for me just a minute here. Good afternoon, Lord. Thanks for coming by again. See, you found us up on the 5th floor and we're not down in our regular room. We got a busy agenda this afternoon. Ask you to be with us to make us mindful of all the citizens of Cumberland County. Make the decisions that are best for all the citizens of Cumberland County. Give us the strength to make the decisions in what the best way you would have us do it. Amen.
Amen.
I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
At this time, we'll move on to the approval of the agenda. Madam Manager, are there any changes to the agenda?
Yes, ma'am. As I had sent out a memo, an email yesterday, I made a suggestion that we add a COVID-19 update from Dr. Jennifer Green, our Public Health Director, and for her to specifically update us on the most current guidance related to masking.
Okay.
And then if the board approves that, I would recommend that we do that after item 3B, because Dr. Green has some information about that item, and I know that she has a call this afternoon with the state.
Madam Chair, I'd like to make a motion that we accept the recommendation of the county manager and move a public health update to item 3B1.
Second.
All approved.
Unanimous.
And we move on to approval of the minutes for the January 13, 22 agenda. I call for a motion.
Second.
It's been moved and properly second. All those approved?
Unanimous.
We'll go to consideration of the agenda items. Commissioners' feedback regarding a proposed general government services facility. Madam Manager?
Yes, ma'am, thank you. And so the board entered into an agreement with Creech and Associates to take a look at our county facilities. Over the last couple of planning sessions, over the last 4 to 5 years, there's been discussion about what we do about county offices in the courthouse because we just don't have a lot of space. And so funding was set aside in the Capital Investment Fund for a study in 21. It was a little bit delayed because of COVID-19. So that process is underway, and the thought was to look at departments that might work well from a customer service point of view in a general services building. And as a part of that, we felt like the board needed an opportunity to share feedback about your thoughts early in the process. And based on that, we've asked Creech and Associates to come back today, and there's some items that they're able to answer some questions, and then there's some items for discussion and maybe some guidance. And so with that, I'll turn it over to Jermaine Walker, our Director of Infrastructure and Engineering.
Well, thank you, Madam Manager. I really don't have anything else to add to that other than just to invite Mr. Green to come up and facilitate the discussion.
Welcome, Mr. Green.
Thank you very much for having me this afternoon. As Jermaine mentioned, my name is Brent Green. I'm with Creech and Associates, and as part of our process and working through understanding how you all work, we've had an opportunity to meet with some of the commissioners and receive feedback. You have before you a memo that captured some of the interesting topics that surfaced during those 2 interviews. And so what I would like to do today is spend less time talking and more time listening and use these topics as a platform for discussion as you see fit. We're at the beginning still stages of this study where information we receive today can be integrated and implemented as a part of our work. So with that said, the questions on the memo, as you see, or the items are separated into 2 sort of categories, if you will. The first being a series of 4 questions. And I'll just walk us through those and sort of open the door for discussion. The first question came from a discussion about the scope of our overall study and relative to the departments that we are looking at in question, should that have been increased? One of the topics that came up was human services as one example of additional departments that were raised during this discussion. And I think, one of the other topics that came up, in terms of facilities, there were several facilities that are owned by the county that are in various state of lease agreements. So the question was, should the study scope be expanded to incorporate all of the properties that are currently leased by the county?
Is that it?
Yes.
I think that's just his first question.
Oh. Are you asking for feedback?
Yes, please. Is that appropriate?
Yeah. Look. Okay, it looks like 4 commissioners are the only ones that participated, so 3 did not. I don't know who they were. But, so we only got like 50% of the people, so I don't know if this is the actual will of the board. But, I don't know how you can plan for what you need if you don't know what you got. We have buildings, we have some buildings now that I know that are not occupied. We have other buildings that we lease from other agencies at one rate or another. We have still other buildings that we lease to people for, some people $1 a year, some people $5 a square foot. Some people include janitorial landscaping, some people don't. I've been doing this for 12 years. There's very little consistency. And my frustration comes in when we have to lease property at a higher rate than we are leasing property to someone else, or we have vacant facilities that are not being used. So I'll wrap it all around to, but my first statement is, I don't know how you know where you got to go unless you know where you are. Should that be yes? You should expand.
Anybody else?
Yes, sir.
Commissioner?
I enjoyed the openness of the folks that I spoke to. They, in my opinion, they had gone out and looked at some of our properties or options before just being told us to go to 123 Keefe Street. And they were writing it down to us when the first they ever heard of that. So I was very, very well pleased with the kind of background. It's kind of like Googling somebody before you go in for a job interview. You at least know whether to say State or Carolina or Duke. You don't when they're wearing the wrong tie. So I was very impressed with the pre-preparation being done before we met. But I do agree with if 3 were really hard on these ideas, 1 was neutral, and then the other 3 are very, very strong against it. It didn't show up. All they need to do is get Mr. or Ms. non-committal, and all that's out the window. So I don't think we have a plan. That's, maybe we ought to get the smaller ones or the more consensus ones that your group felt like, and at least start chipping away at it or something. But I don't see that this, it's an update, but I don't feel like we're about to build anything.
Fair enough. I think the point of today is to receive feedback so that we can move forward in a study in a focused way that represents your desires. And so, yeah, you're right. We're not at a point where we're ready to start construction today, but we're working towards the details that would help us plan.
Well, is it cost effective to try to accommodate the schedules of the 3 that couldn't make it, so that it's not almost half hanging out there? Or is it better just to go on with what you've heard so far? I don't do this.
I think we would operate in either of those capacities, whichever best pleases the board. And if it's more suitable to have feedback from the ones that we were unable to and then come back with another discussion, we're certainly open to that process. Yes.
Yeah, Madam Chair, I just don't want to go down a path and then find out that not everybody's, I don't want to waste, the only thing I hate wasting more than my you'd have to go down a path of thinking that this is the will of the elected body, and then when it comes to a vote, you know, all the work you've done has been for naught. So I think we have to find what's important for us.
And that's really Commissioner Keefe and Commissioners Booth why we came back today, because there were, not all board members participated. And so we felt like for those that participated and provided their time, we felt like we needed to get a little bit more discussion and direction. Obviously, we'll do whatever the will of the board is, but we thought we would be remiss in just moving forward.
Absolutely, absolutely.
Well, President, and one thing that I again will compliment y'all on, this is one of those meetings where it looks like I was actually at it. I mean, sometimes I read things and after a meeting of so-and-so and so-and-so, and I go, I must have skipped that one today. I'll see the tape and I'm there. So, but these were issues that were discussed and presented, and I think the feedback or the compilation of it is accurate as to what was said and done and the vibe in the room at the
Yeah,
time.
absolutely.
I'm glad to hear that, and I think that is part of the reason why we were here today, is because those were interesting and very relevant topics to the point in the study where we were. And again, I think that in whatever way we receive feedback on them from the board as a totality, and we're excited for that opportunity.
Okay.
I agree with Commissioner Keefe that we need to know what we have before we start looking to do anything. We need to see what buildings are available. It just makes sense to know what we have. We need to know what we have anyway, and I'm sure it's somewhere. But before we start looking to build something and all of that, we need to see what we have, because that might not even be necessary. Okay, go ahead.
So based on the discussion around the original topic, would it be your pleasure that we continue down this pathway, sort of hit these one by one, or what would be the best way to move forward? So the topic number 2 was around some of the needs for space within this facility, and the idea that this building was planned for vertical expansion. And there's been some visual verification. If you've been on the roof, you can see where there are some columns stubbed up. So it does appear that was integrated as a part of the design of this building. So on the surface, you would say, well, that looks like a pretty decent option for us to investigate. And it may be, but we wanted to make sure that everyone understood the challenges that are inherent to that as well. It's a building that was designed in 1978, plus or minus, and the seismic codes and the bearing codes have changed probably 3 or 4 times since then. So the idea that the loading and the code requirements of today can still be upheld by this building when it was designed is an item that we would want to verify. So that would be one potential challenge in that strategy. Another is just the phasing and disruption that happens when you're working in a building that is holding court. Now, clearly, we can manage that when construction is done in off hours.
Like Thursday, Friday.
During the evening. During evenings or off times so that the actual proceedings are not disrupted. And so I guess the question that's really inherent to this conversation is, would this board like for us to, we will be looking at options. In other words, we're not going to come back with one solution. We always look at options. So our question is, should one of our options as we consider expansion of this building be to verify that vertical expansion is possible, knowing the challenges that may present?
Discussion?
I'll make my discussion really quick to start it off. First of all, you gotta know if you can do it. And if we don't know if we can do it, it doesn't matter. Is it financially is it much more cost effective to go up vertically than it is to build a standalone new building? And what is that cost savings? We have to look at that as compared to the disruption that happens. But I think it all really comes down to, you may tell us that it's off the table, structurally it can't happen, right? And then there's no real sense in us moving forward on that piece if it's a non-negotiable. Thank you.
We need to know if it's negotiable or not.
Yeah.
We need to know.
So we take the first step of verify, and then we come back and make that decision once we have that piece for the action. Very good. Thank you. So number 3 is really a question that's going to show up again in the discussion items later. As you might imagine, when we speak with this group, one of our topics is the chamber. And so there was a variety of topics or thoughts on whether or not the chamber should have fixed seats as it does currently and be sort of permanently used for that capacity, or some of the other models that you see for chambers have more flexible seating that are not fixed, and therefore the room could be used in capacity beyond just for the commissioner's chamber. So there's a somewhat of a loaded question, but I think the topic there is, are we thinking that the chamber wants to be sort of reserved specifically for use by the board and therefore, have fixed seating, or do we want to consider it to be a more flexible type space?
I discussed during our meeting that we need to make sure that we are able to accommodate all of our citizens, all of our commissioners. So we need to make sure that it's feasible for everybody. So being fixed won't necessarily make it feasible. We have someone in a wheelchair, and we may need to move that chair out the way. If it's fixed, we can't do that, and then they're off in a corner somewhere. So we need to make sure that it's suitable for everybody. Anybody else?
You're aware that there is a push to move administration out of this building? Has that been discussed?
Yes, sir.
Okay.
Anybody else have any comments?
Okay, thank you. So the last item on the question section is, again, a topic that sort of resurfaces over and over again in different departments and groups, and this notion of drop box or drive-through. I think a lot of these topics, as your manager said, are centered around customer service, but there's a balance between the customer service component and the ability to secure the building. And so I think that there's been discussions about having drop boxes that are completely separated, stand alone from the building, to avoid that opportunity for someone to have a way of dropping something in directly into the facility. So the question becomes, as we balance customer service and security, would it be this board's desire to have a drive-through located if we're planning for a new government services building?
Discussion, Commissioner Booth?
Thank you. I hadn't thought about that, but I just don't think of what would be gained out of the newspaper headlines to bomb this place, but even like an anthrax or an exploding paintball or something. I mean, so I see that, but I am concerned that they shouldn't have to come up to get the elevator, dread coming up here, then get in the line between where the tape is to go in just to file their taxes, and then come back later on after they've been told and, ride the green mile up to go pay taxes. Even if it's like an ATM thing, then that would, just something to alleviate the line with the bank chrome and taping, the little stretch tape things, across the middle of the hallway or something. So I hadn't thought about the bomb thing, but I'm cognizant of it now, so I can go to an ATM thing, right, to talk to my clerk.
Commissioner Keith?
Yeah, thank you, Madam Chair. I'm sorry, but this is important to me. Who came up with that? I mean, I've never heard, there's banks all over the world that use drive-throughs, and I've never heard of this happening, and although it's a government facility. And are we going to, I've never heard that, are we going to take the citizens' ability to do this, and on the remote possibility that could ever happen? Because I've been in that elevator too, and I've seen people with oxygen tanks coming up to the tax office who can barely walk. And I mean, if our citizens are not our customers, then what are we doing here? So I'd like to know, who brought up that? Was it a commissioner that brought up? You're too harmy, Jermaine. I mean, it's the people's building.
Actually, we did a study several years ago and about options for tax payments, and we actually looked at the area under one of the porticos before the building, the parking lot renovation, and that came up as a security issue from the sheriff's office. So Jermaine can't take full responsibility for that. So it's in our security review and outside security review, that came up as a concern. Perceptive or
Are we
just
aware of that
reality?
ever happening at any government building? that
Sir?
somebody using a Dropbox?
Yes, sir, because in the library, I think it was Bordeaux, if you'll recall, someone put an explosive in the book drop, and we had significant damage several years ago, not probably within the last 4 to 5, in a book drop. So now we're working on moving the book drops away from the building because currently they're attached. Right now, we have a tax drop-off box out in the parking lot. And so we've tried to accommodate the citizens by doing that, but not have them attached to the facilities.
Drop-off boxes.
Yes, sir.
They're being removed now, aren't they? Well, that's the mailboxes, I'm sorry.
Anybody else? Any questions, comments?
Everybody's got cameras down.
Mr. Green, go ahead.
Thank you so much for the feedback on that. So that rounds out the question section. Some of these perhaps will go more quickly as we move through these clarifications. There was discussion about 707 executive and whether or not that should have been included in our scope of work based on ownership. And while we did complete a space needs analysis for community development, which is the department that resides there, we have learned since that question came up that 707 is actually a leased property. And so we have removed it from the scope of work. So 707 as a facility has been removed from the master planning based on that.
Is this the Winding Creek property? Winding
It's
Creek?
it's the annex, this very, very small building right behind Winding Creek.
Behind Winding Creek?
Yes, sir.
Oh, okay, I'm sorry.
Yes,
Thank
sir.
you.
Clarification number 2, and I think that's revolves around the desire to maintain offices for the commissioners, which is a fantastic amenity that we would plan for in the event we're planning for a new facility. And the idea being that they would want to be of a consistent size, and we've listed that size there as 120 square feet, which kind of represents the average of the ones that you all are occupying currently. And there was also a desire to have a small conference room within that suite, so the meeting spaces would be available to you all. So that is the program element that we're carrying in terms of the commissioner's office suite at this time. Good. Very good. So the historic courthouse is also a great topic. What a wonderful facility and a tool it is that you have. And I think there's definitely consensus that it needs to have a permanent function that can benefit the community. So there have been 2 ideas, one that was sort of put on the table before we came on board, and then another one since. I think originally there was some talk about perhaps repurposing the courtroom as a chamber and perhaps moving some administrative offices, even your offices, over into that facility. And that's an option that sort of was shared with us when we came on board. Another option that has surfaced that's gaining some positive momentum is the idea of converting it into more of a museum and allowing that really to sort of combine some of the artifacts that are around. There's a great amount of those at the library and allowing the library and those pieces to all come together and letting this become a museum that we can restore the courtroom and keep it sort of as the piece that it was originally intended to be. And so those are really the 2 strategies that are on the table right now for the historic courthouse. We have not decided, because as I mentioned earlier, we're always looking at options. Perhaps we'll be looking at both of those. So I guess the question becomes, is it still your desire to consider relocating the chamber into the 2nd floor of the courthouse?
Historic courthouse.
Yes.
I really don't know where the board is on this.
I am not.
Yeah, okay, I am. So, we can't tell me.
I am not in favor of moving over to the historic courthouse. Yes.
Thank you, Madam Chair. And so help me to remember. The conversation started about this historic courthouse when our vice chair brought up about the way that our employees were working in unacceptable conditions. Is that the way this was brought up?
Actually, I think it started just a little bit, that was one of the conversations, but I believe may have been Commissioner Keefe, and if I'm wrong, forgive me, that made a motion and the board approved it to allocate $3 million of ARP funding to look at the feasibility of moving the commissioner's offices over to the courthouse and then renovating the historic courtroom for the chambers for the commissioners. Now, since that time, there's been quite a bit of conversation, and even the county attorney has weighed in and said that all of the renovation could not be covered by ARP funding, ventilation system, and that type of thing. And I believe when we brought Creech and Associates in, what we basically recommended to the board was let this item be a part of the study. And looking at it from the perspective of the use for the commissioners, or is there another use that's more suitable for the historic courthouse? But regardless, Commissioner Evans, restoring the courthouse and renovating is a part of the recommendations.
Oh, I'm not finished, Madam.
I'm sorry.
That's okay.
I was just looking to see if you
That's
agreed
okay.
with what I said.
That's okay. So the conversation was, a portion of the conversation was about redoing the part of the courthouse where our employees, where staff work. That's unacceptable. Then we went over to, if I heard it right, we went over to talking about redoing the whole courthouse, which I didn't have a problem with at first. And so now, we're still having the conversation. It seems like the majority of the Board of Commissioners, and correct me if I'm wrong, the majority of the Board of Commissioners is not seeing eye to eye on going on with the refurbishing of that place, of that courthouse, for us to move it. Is that where we're at now?
I think, I would tell you my perception, that everybody is in favor of renovating and upgrading the historic courthouse, but I'm not sure everyone agrees on the use. Would that be a good perception?
That would be a good perception.
I think that's where we are. Please tell me if I'm wrong.
So everyone is in favor of refurbishing, just not moving. Is that
I
correct?
guess the purpose, there's not a complete agreement on the purpose after it's been renovated. That's my perception.
Okay. So, now let's, if you don't mind, I'm sorry for taking up too much time, just trying to get clarity. And so, when the discussion was brought up regarding the offices of where the staff and employees work at not being good at all, where are we at with that?
Well,
Yes, sir. We're actually,
Jermaine, can you come to the side?
yes, sir. We're actually in the process of doing upgrades on several of the floors. So we just finished FAMPO, a couple of the transportation areas, a couple of the planning offices, and we're in the process of moving downstairs. So all in all, incrementally, we're doing it, and I can put together a presentation of all the work that we've done so far, and bring that before the board, to appoint the board.
Okay. Madam Manager, the renovations that they're doing, is that included as funding? How is that being funded?
Jermaine.
It was funded in the FY22 CIP program, sir.
Okay, so it wasn't no ARP funding?
No,
So
sir.
we can't
Okay,
use
let me
that.
ask you this, can the ARP funding be used for assisted?
For what? No, sir.
And so, and there's difficulty talking about using ARP funding for renovations of the courthouse, period. Is that true?
No, I mean, you can, and the county attorney can probably describe it better than I can, but you can use it for ventilation systems and anything to do with social distancing and related to the public health COVID-19 issue. Is that correct?
That's correct. What's applicable, they did the final rule, which just came out a couple months ago. They added some additional requirements of any kind of infrastructure. We would have to do a written document describing the stuff and why we're doing that, and have two estimates of other projects that would have accomplished the same thing and showed this was cheaper. That's a new a new wrinkle, so it's those are the last regulations, so it's still on the table, but there's more involved in it now, in terms of doing it with our money.
I don't share quite understood that, but,
We have more to prove now to use ARP money
okay.
with the final regulations.
But it can be used for ventilation and things of that nature, correct?
Yes, sir.
Do we have that problem there?
If you went in and redid the ventilation system, then you can use part of it for that, but you couldn't use it for the entire system.
Okay, well, maybe I need to ask Jermaine. Jermaine, is there a problem with the ventilation system over there in the courthouse?
Currently, no, sir.
There's not.
No, sir.
Okay. Is there another reason we can use the ARP funding?
Another reason?
To use the ARP funding for that building?
We can use ARP funding to accommodate the use of the building for the governing board's purposes in ways that comply with the pandemic protocols we've been in. That doesn't mean we can buy every chair and all that sort of stuff that goes in there, but there can be money in the actual configuration of the building. For instance, they were talking about structuring the dais so that commissioners had eye contact and were appropriately seated. There are things like that we can justify as pandemic, complying with pandemic protocol. The thing that's more difficult now is we would also have to show that we looked at two other alternatives to accomplish the same thing that were more expensive. For instance, renovating the downstairs office space or meeting space. That would be one of the alternatives to look at. I don't know where we go with the other, but it's just a little more complicated now. But it's still on the table.
So this is another item that we're kicking the can down the road, because apparently there's a number of people that don't want to see us as commissioners over there. I think we have a majority of them. Is there a majority that believe that?
I don't know.
It was my understanding that the board actually voted to put this in the medium-term ARP stuff as a project, and I have continued to look at, to try to do the work, like this additional work can be done to develop what we can do. So it's my understanding the board voted to do that.
You're understanding the board will do what, sir? I'm not
To
understanding.
voted to include renovating the second floor, the old historic courthouse meeting space, courtroom, as a board meeting room with ARP money.
And it's still in the study.
Yes, it's still.
If I may.
It was not a short-term, not on the short-term list because it's not possible on the short term.
Commissioner, Keith?
I was one to do that. I knew that there was limited use of ARP funding. We could renovate at that time the commissioners' chambers with ARP money to allow for social distancing and pandemic assembly. So I was hoping that we could use that $3 million with additional funds to renovate the entire courthouse. If the commissioners are not going to be going over to the historic courthouse, then we would have to pay for it all without ARP funding internally.
But $3 million won't pay for it.
It will pay for the commissioners' chambers and the offices area. It will not pay for the offices like you saw in some of the other renovations. That's correct. I think they said somewhere around 7 to 8. So instead of the county putting $8 million in, we put $8 million less 3.
For the purposes of Mr. Green, his conversation is, what is the board's pleasure of the two options that we gave? Is that where we're at right now?
It is, but we can also just leave it because we are looking at options and we can look at both of them. For right now, we can continue to look at this renovation as well as this museum idea.
Well, we don't want to stop the process. I don't think that interferes with what Jermaine is doing, because that still has to happen. We're only talking about the actual courtroom. Is that what the discussion is?
Madam Chair, I don't know, but I don't know how we can give direction to move forward with renovation without knowing the purpose.
The reason I said move forward with renovation is because I'm thinking about what Commissioner Evans was talking about, the offices down there.
Are we going to keep the offices there?
Well, the people are working in there now, so that's what I'm saying. It doesn't stop what Jermaine is doing. That continues. One has nothing to do with the other, correct? Am I correct?
That is correct, but what I will say is that what renovations are being done now, those same offices will most likely be utilized as offices in either of those scenarios. So I don't think that effort is going to waste in either solution, if that is the concern.
Any other comments about this particular area?
Well,
Commissioner Evans?
thank you, Madam Chair. The one thing about it is, this is another situation where we're just talking about and talking about and talking about and doing things. And my thing is that I would like to see the individuals that are working there, currently working in those offices over here, what you are doing now, Jermaine, and I'm very grateful for that. But, let me ask you this, that $2 million, is that held up for us to use?
It's earmarked, yes, sir. It's
It's
a part of the
earmarked.
budget, and the ARP budget. Yes, sir.
I just think that, with the ARP funding, could you give me the definition of what the ARP funding is for?
A definition?
Yes, what is the ARP funds used for? What are they supposed to be used for?
There are 5 categories that you have to fit them into. This one was, and I'm paraphrasing, but this one was to minimize the spread of COVID through mitigation measures in an infrastructure setting. The stuff we talked about was the board that right now does not have a meeting facility that complies, that is under the governor's order, that was under the governor's order. We were waived. We didn't have to have it because all government activities were waived from that order, from the application order. The board, I think, wisely chose to comply with the governor's order to the extent that we could. But getting us in getting you a meeting facility to conduct the government's business, which is an essential function, we can use some ARP money to accomplish some of that. That's what this is about. It's not about going there and, renovating that entire room and, putting in wall paneling and all that kind of, but some components of it. They're expensive. Some stuff is expensive, but that's what this is as related to this specific project. For any given project, there's a different category that we have to fit these things in.
Okay, so all of this is coming out still back to deciding whether or not we're going to use that office.
I think where we are, we've heard you loud and clear. Mr. Green's going to continue forward with a design that meets the desires of the board to have the boardroom over there and the offices for the commissioners and staff. That's what I've heard.
Okay.
I would suggest there really needs to be a definite plan on this because, we're going to be up against the wire in terms of getting this work done. And we need to get a plan in place.
This study is a key part of that next step.
Okay, well, see, that's what I'm trying to get at.
Yes,
We
sir.
need to come to a determination what we're going to do.
And that's what
And
we're
you're
asking.
us.
Yes, sir.
And so, how can I frame this motion? Can we make the motion?
Well, hold on, before you make the motion. This is not that presentation yet.
Oh, sorry.
Mr. Green. Did anybody else have any other questions on that? I think that we'll come up with a conclusion before, by the time it's done, but.
So I'm going to move forward knowing that we're going to come back to that item. Item number 4 under the clarifications is really just a series of topics around the Commissioner's Chamber, and I'm going to kind of run through them quickly. I don't know that there's going to have to be too much discussion on these, except for really one of them. We've talked about the dais being ADA accessible as well as the entire room, including the podium, which is another line item. We've also talked about having a little bit more space at the dais for you all to have, at your individual stations. That also ties back to some of that money that we were just talking about relative to the COVID funding. We've talked about the dais making certain that it has sufficient power and technology so that you all aren't having to reach across each other, or that you have the infrastructure that you need to conduct your meetings. We have talked about confidence monitors you all are currently using, looks like iPads, and whether or not that system moves forward, or if we come up with something that's a more integrated confidence monitor. We've talked about
about the way that your staff that sits adjacent to the dais should look and should be accommodated. It should be planned in a new facility instead of kind of being an afterthought. Is really what the topic was there. Back to the topic of fixed seating versus flexible that we've talked about earlier, and I don't want to have to resurface that, but, again, I think the idea was that that decision can change the way that room is used, but really of note that we talked about a capacity of 80 seats, and regardless of what type seats we end up with, that's a capacity that I think everyone felt comfortable with as a right-sized commissioner's chamber. Should there be a need for meetings that have larger attendance than that, we'll have multiple opportunities for overflow in the building where it could be broadcast for additional citizens. We've talked about ADA seating already with dispersed seating so that there isn't any accommodations that have to be made special that will be planned and designed into the room. We've talked about having an intentional space for sign-up for public speaking and not having it be a table that kind of gets moved out and into the hallway. We've already talked about the podium, and then we've talked about that support suite that goes with the Commissioner's Chamber, which is that executive conference room for closed session, having a capacity for at least 16 restroom and kitchenette. Basically, the same function that you all have, similar function here. So those were the topics on the Commissioner's Chamber that we just put forward that we had heard sort of from the group that we interviewed. And we can sort of leave those as statements, and they will inform the program for that space as we move forward at this time. Unless anyone has any questions or additions to this list.
Any questions or comments?
Very good. So as we're making our way to the end, number 5 there was a discussion around technology and how that implicates in staff. And I think that we want to tie that back to customer service. And the idea being that as technology progresses, we may have more staff in one area at IT, perhaps less staff in others, but effectively that's going to not result in a net reduction. You're going to have a static number of staff in that regard. And I think that this team is working with the leadership committee to make sure that we're continuing to consider ways technology can influence the way that we're serving customers as we plan for a new building. We've talked about kiosks earlier as a way of improving. That's just one limited example of the thought process around that. Number 6 is a discussion point that came up during one of our interviews, and it was saying that, we're not sure what the site for this new government center would be. That has not been determined at this time. But if it were to be one that's out of the downtown area, it would be a matter of convenience, perhaps, to maintain some type of office here in the downtown. And that's exactly what number 6 was. We could maintain some shared office either here at the historic courthouse, so that if needed, there was a footprint for commissioners in the downtown. And then number 7, as we round out this discussion, is the topic of, telework or remote work. And this kind of has a wide range of solutions. We work across North and South Carolina, and I see the full spectrum of what counties are considering in this regard. It does change the way that we think about space, and I think wisely it was decided that we're sort of surveying staff internally at this time to ask the right questions about which positions that could accommodate, is currently accommodating or could accommodate, so that we can come back to you with a more informed answer about if that was an initiative to consider, how that could change the way that we think about space. Okay. So that was number 7. That was the last of our clarifications. I'm here to answer any questions that you may have. I appreciate your time as we made our way through this list. Does anyone else have anything for me this time?
Questions for Mr. Green? Madam Manager?
No, ma'am.
So the direction that you're seeking direction, or have we given confused?
I think the only outstanding item may be back to the one about the purpose of the historic courthouse. So we can have Mr. Green proceed in the study by looking at what it would take to upgrade the historic courthouse, to move the commissioner's offices over there, and work with the county attorney's office on how much of the ARP money can be utilized.
And we are on the same page that we need to know what buildings that we have out there.
Yes, ma'am. I have that in my notes.
Okay. Thank you, Mr. Green.
Thank you very much. Appreciate your time.
Madam Chair,
Yes.
right now, it is my understanding that the board, because of previous votes, is moving forward with county commissioners' offices and room being in the historic courthouse. Do I understand that correctly?
I believe that, yes, sir. And
That
I
was based on previous votes.
And I think actually that included legal and board clerks of the board and managers, as I recall.
Right, I want clarification for you, because I know how difficult this can be. And that we still have $3 million in the budget for a portion of the renovation of that. I, like you, Madam Chair, don't sense a unanimous desire of that. And to Commissioner Evans's point of kicking it down the road, this year marks 100 years of that building. I think it's an opportunity to do something. And I think the board needs direction. I think the staff needs direction. I don't think it's appropriate for us to ask the staff to continue down that road of making commissioner chambers, commissioner offices, and executive offices that the public can go, if it's not the desire of this board, because that will just cause them to do a lot of work that is not necessary if 4 people don't believe that that's the right thing.
So you're gonna make a motion then?
I don't, the motion, Mr. Evans, the motion is already on the table and staff has direction. So if there's a change in that, it is only fair and respectful to the staff, in my opinion only, that we give them direction.
Well, Madam Chair,
Yes.
apparently, there's still some confusion there because you're saying that the board wants to continue, that we should stop kicking the can down the road and go ahead and make a decision. Because from where I'm sitting there, I'm not hearing clarity on it. I'm not hearing clarity on whether or not this board still is in the mix of wanting to go ahead and use that particular facility for our meeting place.
I think the manager has said herself, she is very clear. She knows what her directive has been. And she's a busy person. So if that is, I am an advocate. I'm an advocate financially for the ARP funding to go over there. I'm an advocate, but I believe that's where it should be. But I'm not hearing that from the entire board, and I don't want to come down 6 months later and delay this process, whether it be a renovation of the offices or anything else. Let's make a decision. Let's move on. Get staff direction to come back to us so we can approve.
Okay. Can I make a motion?
Let me say this. The question you just asked her was if she is clear that our offices would be located in the historic courthouse. And she said yes, which means that we voted on it at some point that that's where we're going to go. I've been clear that that was not what I wanted, so my vote doesn't change. And so go ahead and make your motion, but I think that I know where you're going. But go ahead and make your motion. What I don't want to do is, are we going to have one motion, knock out another motion?
We made a
That's what
decision
it
if we come
sounds
back
like.
6 months later. But
I hate to interrupt, if I may offer just one quick suggestion. Perhaps, forgive me if this wasn't presented as clearly as it should have been, but the notion from our side is that where we are in the study right now, because we are still studying options, we would like to look at the option that we've just described, as well as the option to move a museum into the building.
So that's
And
what I
come
was,
back to you all and share what we find in looking at both of those. So just laying the decision until that point.
so it sounds like there needs to be a motion if they're going to continue to give us options or go to bring back options to us. Is that what you're saying?
Yes, ma'am.
Is that what you understand, Madam Manager?
I remember there was a motion that was passed 4-3, and to move forward the motion as Commissioner Keefe had laid out. During the discussions, a museum came up. And so we're just trying not to surprise anyone and come back and communicate with the board along the way. And so we realize We're operating on the primary motion.
Thank you. Do you have any new information for us to change anything? I mean, isn't this just kind of a memorandum or update?
Yes, sir.
There's not a single estimate of costs, there's no measurements, you haven't, taken a sample on construction materials, RFQs, RFPs, nothing.
That's our next steps.
It's an update on where we are right now, which is, we don't even know how much, if $3 million would cover it, or $3 will cover it. We don't even know we're there or we're over here. It's just where you are in today's life, right?
Correct.
I don't know why we vote on to put him somewhere else other than where he is, which is, has no information to make a recommendation on building a desk.
I think we're headed in the right, I think we know where we need to go. We're just providing feedback on the discussion from the board members that participated.
So no action needed. Is that what we're saying?
I don't think so.
Okay.
Not from our perspective. Thank you.
Madam Manager?
Yes, sir. Yes, ma'am. And so item 3B, Commissioner Evans had requested this item. He had asked if we were providing transportation services for public health clients, and I told him currently we are not, but I've had some discussions with Dr. Green, and that is one item that she would like to look into into the future, and she actually had some ideas. So I had mentioned to Commissioner Evans that I was inviting Dr. Green here today to maybe talk about what her thoughts are in the future, because transportation is a barrier to our citizens and their appointments at our public health center. So if it's okay, I'd like to invite Dr. Green to the podium unless Commissioner Evans would have anything to say in the beginning. Okay, Dr. Green, and also to the board, I want to let you know that the chair of the Public Health Board, Dr. Ojo, is here with Dr. Green as well. Welcome, Dr. Ojo. Thank you.
Good morning, Commissioners. Good afternoon. I don't have a formal presentation for this piece, but I just wanted to provide some information about what we see and hear about transportation. As the county manager said, we know that transportation is a barrier to care for many folks when they're seeking medical appointments. We, in August, began to screen patients and really launched our full implementation of that in January, screen patients for their social determinants of health. So when they come into the building, we ask them questions about, do you have food insecurity? Do you have transportation challenges, and a number of other things. And so we formalized that process. That's a part of Medicaid transformation that we were required to do. So that gives us an opportunity to identify individuals that may have transportation needs. Of course, it doesn't identify folks that maybe never got to us in the first place because of their transportation needs. We also see, we have a pretty standard but high no-show rate. And some of those reasons are because of transportation. We have not formally studied that. But we know from patient conversations that transportation can be a barrier. We work to identify if that is a barrier for them. We work to get them a bus pass, but of course not all of our citizens live on a convenient bus pass. It makes it challenging if we're trying to get you a same-day appointment, then to get you a bus pass and to get you on the bus and to the health department. That typically doesn't work out smoothly. So we know that this is a challenge. There are other places around the country that have utilized other platforms for to assist with transportation, and I'll talk about those in just a minute. When we've identified a transportation need, we can, for our Medicaid patients, we can refer them to DSS to help them get transportation set up for maybe a future visit. In our STD program, specifically for TB, for our TB patients, we do have a small amount of funding that will allow them, if they have a barrier to getting their TB treatment, to get some limited transportation to the health department in those instances, and so we do have that allowable cost. And in August, we received funding from the Cumberland Community Foundation, and we have a small grant, a 2-year grant, that allows us to address some of those social determinants of health, and including providing transportation. So, again, in very limited amounts, we can get somebody a bus pass, or we can get somebody a ride to the health department. But we have not formalized that process where we do it for every patient all the time. But we are putting systems in place that we could do that. There are 2 places where I've really seen this happen around the country, and I'm certainly willing to do more research if that's the interest of the board, where they've used platforms like Uber and Lyft to get individuals to their appointments, and specifically in public health departments. For example, in Denver, their public health department does that. If it's an identified need, they have a HIPAA, both Lyft and Uber have HIPAA compliant platforms that you can control the budget and who you are providing transportation for. And it's simply the way it works is we identify a patient that has a transportation need. We have essentially a dashboard that allows us to schedule a visit or schedule that person to be picked up from a designated address. We track that visit, and they get to the health department and back home. We are able to control it so that, we can't take a stop off at the mall or at the, any other place. It just takes you home and to the health department and home. And then we can coordinate the budget for that as well. So there's a couple of different ways. So there are some platforms that have been used. Again, the Denver Public Health example, they saw a decrease in their no-show rates. But that is certainly a barrier that we've identified and that we are working to address in some capacity now. In terms of Commissioner Evans, if you have any, or Chairman Stewart, if you have any questions, I'm happy to answer or just listen.
Dr. Green, thank you so much for coming over and giving us that information. And I want to make sure that I understand, you do feel that there's a need for that to happen here in Cumberland County with our health department?
We do know that is a barrier. Patients have, we have not tracked that formally, but that it has been identified as a barrier for many of our patients. That's correct.
Okay. Madam Manager, for tracking that, how do we go about doing it?
We can do a couple of different things. As I mentioned, we are doing some screening that we have really launched formally in July for transportation. We also have a social worker on site who has a subset of our patients that he already tracks transportation needs for those individuals. And then we also can ask patients when they have a no-show, when they don't show up to their appointment, we make an attempt to call them back and say, is there a reason you missed your appointment? And so we just have not formally tracked that, but we can do that if that's the pleasure of the board.
Well, and Dr. Green, please forgive me, I wasn't trying to slight you, I going to the manager, because I was
that's
going to
okay.
the manager trying to set her up for this, to see about having this done and look forward to it. And while I'm asking, the ARP money can be used for that as well, okay? Transportation?
I think it could. I think
Okay.
possibly it could,
Okay.
depending on if they're disadvantaged, if they've been impacted by COVID, if they live in a qualified census tract. I think that's possible.
Commissioner Key?
Don't we already have a program that works through planning that's similar to this?
It's similar, but everyone wouldn't qualify. So some of it is elderly and handicapped, and these individuals might not be Medicaid eligible, but so I think that not all of Dr. Green's patients would qualify for the program at the planning department, the rural program.
But the rural program is people that live outside the city who are looking, and it's not just limited to medical. They can use this as if they're going to work, go to the grocery store.
Yes.
And Charles, what I'd ask is, do some of these people know about that program? Because it's going to be a situation where somebody goes to the doctor or somebody goes to the health department and they need to stop at the grocery store on the way home, and they say, I'm sorry. Where?
Well,
and I hear you, and I hear you. But the intent is to make sure that these individuals get from point A to point B, from home to the health department. As Dr. Green so eloquently spoke and said, that it's not about going and stopping at Hardee's or McDonald's or Food Line. It's just to provide that service to make sure that you get the medical attention that you need.
I'm just wondering if they know about the program or
And we
if
do.
it exists.
Yes, and so when we identify a transportation need, we try to get them referred to either to DSS or the Community Transportation Program where they're eligible. And if they're not, I think our challenge is when they kind of fall in the gap or they can't access that program in a timely manner. So my appointment is, I have a same-day appointment, but you need a little bit of planning time for those programs. So, but yes, we do make sure that they are aware of that.
Commissioner Booth?
Thank you, Madam Chair. We must have read the same article or Googled the same thing, because the downside of that, of the Uber and the Lyft, or even other people coming up with Uber Lyfty copies, was that more often than people putting bombs in courthouse mailboxes, are people figuring a way to get government money to fund them to do other things. And it's not unreasonable that after they get their appointment at the health department and they get their prescription, that they may want to go to the pharmacy to get their prescription. So we're going to say, no, we're just taking you home. And now we didn't really service them. We found out that they do need medical care, they do need drugs, so we're taking them home. So I would much rather, since we have, if the opinion is that this program is working, expanding that, because it seems to be receptive to what I was writing down here is the number of people, the addresses in, out of the city, how far out in the county, their appointments, what facilities are the facility hours that we'll be dealing with. I mean, if someone calls and says, yeah, I need a ride about 11:15 tonight, where are you going? I just need, you just drop me off in front of the health department. No, the health department's not open. Well, I've been told I can get a ride to the health department. I need to ride to the health,
And we would control the dashboard, so we would initiate the visits and not the, but point heard, yes,
Yeah,
sir.
but that's what I'm saying, it's just human nature to try to figure out some way, and the poor little Lyft driver and the Uber driver, he doesn't, or she doesn't have time to sit there and haggle over it, because they've just accepted another ride down the road, and so they're trying to get away from the one, or over-explaining to the one, and trying to go get their next ride. I mean, they take these little $5 to $15 rides all over the place. They gotta keep moving, they can't be sitting around. So if we have an agency, expanding that and building on their successes, helping them with their glitches in the matrix, would make more sense to me than, trying to Uber and Lyft it, because I read where people try to take advantage of Uber and Lyft if someone's paying the tab.
Anybody else? Thank you. Or you have something else?
I don't know where Michael went with that one.
I address the need, but I just want to get focused. We always get focused and stuff, and I didn't want to come back in a month and have a proposal from Uber and Lyft on taking our patients somewhere. So that's what I'm just saying is, there's definitely a need, but we're working on something that's similar to it. We aren't using Uber and Lyft yet, so instead of going out and getting all that, are we not able to do it ourselves by refurbishing, replenishing, what's already in place?
So I think what we would need to do is work with Dr. Green on establishing the need and defining the need, and then looking at the alternatives.
Well, you know what, the thing about it is, we pretty much know that there's a need.
Yes.
That's why Dr. Green has said today, that expressed to us her feelings about that. So it's just a matter of figuring out how we're gonna do it. Right?
Yes. How we would do it and pay for it, yes, sir.
Exactly. I mean,
Thank you, Dr. Green.
Thank you.
Dr. Council, did you have something to say? Okay. Madam Manager, we'll move on to
Yeah.
B.
3B1, where we've asked Dr. Green to provide us with a COVID update and update on the most recent guidance. And we also have with us Dr. Conley, the superintendent, as well as their chair and their vice chairwoman.
Thank you for coming today. Thank you, Ms. Cannon. So this afternoon, I wanted to make sure we had the opportunity to provide a COVID-19 update with the most recent data and metrics and sort of where we are in the path. And so I'll give the disclaimer that I always give is that this information is very rapidly changing, and I put together the slides today and yesterday, so things may change or shift after our meeting, and I will make sure that this is for the folks that are listening online. We have some links here that you could go to if you are interested after the presentation, or if you're watching the recording, where to go to get additional information. So we'll start with some metrics. This is from the CDC's Data Tracker. So on the left-hand side of the screen, you see the map of North Carolina. This is their community transmission map. We are in a county of high transmission. And so we use a few metrics that we've discussed this before to determine our community transmission levels. And in Cumberland County, we are in the red, so that means we're in high transmission. In the last 7 days, we've had about 31, almost 3,200 cases. The CDC Data Tracker lags by a few days, so it's probably just a bit fewer than that as our numbers start to decline because their data lags by about 2 or 3 days. About our case rate, which is our cases per 100,000 population size, is 953. Our case positivity rate is at 33%. And then we've had approximately 519 deaths in our community. So high transmission. So where do we get that metric from? The CDC defines community transmission using two metrics that we just talked about. One is that case rate, and if it is above 100, then you sort of get in the red column. And we are at, again, about 900, although it's a bit lower than that because, again, the CDC Data Tracker lags just a bit. And then we also look at our percent positivity rate, and if it's above 2%, you're in the red, and we are at 33%. So we're in a community of high transmission. So, and even accounting for the lag in data or the lag time, we would still be over 100 cases per 100,000 and over 33 and over 10%, even accounting for that lag in data. So this is also from the CDC Data Tracker. This shows the top chart is our case rate over time since May of 2020, or a little bit before May of 2020 on the top. And you can see it looks a little odd now with the Omicron surge, but you can see when we first started our pandemic, we had a few bumps. The September timeframe, you'll see this better on the next slide, is when we had the Delta surge, and the big spike is our Omicron surge. So that hit us right at the end of December, early January, and then now you can see that we have been declining our number of cases over the last just about 2 or 3 weeks. We've started to see a decline in cases. The bottom is our death rate over time, the beginning of the pandemic, and you can see that we really last January, we had a large spike in our death rate that dropped over time, and it was really pretty flat, relatively speaking, throughout the summer. And then we had our Delta surge, and we saw a spike in our death rate, and now we're seeing a drop in our death rate too. That's a bit because Omicron seems to be less severe, less deadly, so we haven't seen the sharp increase in deaths that we've seen with other surges or with other variants. But I will note that the death data tends to lag behind. It's what we call a lagging indicator. We see cases increase first and then deaths tend to follow. So just for context, I know part of the reason we're talking this today is about the public health abatement order. So I wanted to just make a point about where we were when we put that in place. So the red arrows show more or less in August, so in September when that order went into place, August the 27th, those red arrows show where we were in the course of the pandemic. And so we are higher than where we were, and while our numbers are declining, we're higher than where we were initially. So this is some Cumberland County Schools data from in collaboration with the Health Services Director, Ms. Shirley Bolden, who helped me put this, who shared this data with us. So this is, I have 2 different weeks of data. I just wanted to show the progress. So that first column shows the number of students and staff that were positive. The next row down, so about 1,600, almost 1,700 students and staff that were positive the week of January the 14th to the 20th. Last week, that number dropped significantly in about half. We had about 1,200 or 1,100 students in quarantine in the previous week, and last week that number dropped to 375. And then our case rate, this is a Cumberland County Schools specific case rate, so it doesn't account for other non-Cumberland County Schools data. Their case rate, their percent positive is at 38%. 2 weeks ago, and then this most recent week, it was at 36.4%. They had 5 clusters in that first week, or mid-January, and then the most recent week, we didn't have any clusters. We had 6 schools that were on what we call cluster watch, meaning they're getting close to being defined as a cluster, but not yet. So overall, their metrics are certainly improving, but remain high. This number shows this chart shows our hospitalization data over the course of the pandemic. You can see some of our surges with Delta and Omicron, so that first big bump is last January, where we saw a big increase. The next bump there, that second wave, is Delta, and then this next wave is in hospitalizations are increased there on that last, right on that right-hand side is our Omicron surge. So our hospitalizations certainly are coming down. Our numbers are improving. The hospital was gracious enough to give me some updated data yesterday. We had 101 patients hospitalized or in the emergency department, 18 patients in the ICU, and then 2 of those were pediatric cases, or 3 pediatric hospitalizations. For context, in July, we were, last July 2021, we were at about 15 hospitalizations daily. This is our vaccination data, and I've highlighted a few points here. So our total population, our vaccination rates, we have about 58.6% of our total population vaccinated. J&J that are not vaccinated at all. So of the fully vaccinated individuals, we have about 13%, just under 13%, that have received a booster shot. And then we have an age breakdown there with our older population. They're much more boosted than our younger population. So just to give a bit of history for the benefit of the public, in August, this body, the county commissioners, took a vote and requested that I put in a public health abatement order. That went into effect in August 27th, 21. And that abatement order required face coverings in all public buildings and indoor settings, regardless of your vaccination status. So it applied to all of, it was countywide, it applied to all of our municipalities, including the city of Fayetteville, all public buildings. And this was authorized under our general statute in the law, the North Carolina Community. So I wanted to just review a bit about the current masking recommendations, and we've tried to be consistent about making sure we're sharing the most recent guidance from our state health department and the CDC. So those are the two bodies that we're going to focus on today. The Centers for Disease Control and Prevention recommend wearing a mask when you're indoors, and specifically regardless of vaccination status. And that's really to maximize the level of protection for those that are, even if you're vaccinated, we always talk about layering up those levels of protection. So that's a current recommendation, to wear a mask when you're in indoor public settings, when you're in a community of high transmission or substantial transmission. And their recommendation, we've seen in recent days, we hear talk about upgrading your mask to wear the mask that fits you the best, that's the most protective. So if you can manage to wear that's your most protective mask, as long as you can wear that. And then they also recommend universal masking in K through 12 settings for anybody that's over the age of 2, regardless of vaccination status. The CDC's federal order continues to require vaccines or masking on public transportation, including our school buses. So just a shift to our North Carolina guidance. The North Carolina State Health Department has, and I pulled this directly from their Strong Schools Toolkit, has some guidance about masking as well. And so they also recommend masking in public indoor settings when you're in high transmission. You'll see that this really aligns with the CDC guidance, and that schools should base their recommendations based on that. It's defined by the CDC. And so that means if you're in high transmission, and I color-coded this for us today, if you're in the red or the orange, wearing a mask. Consider lifting those mask restrictions in schools when you're in moderate or low for at least 7 consecutive days. Continue mask requirements for unvaccinated individuals, and also vaccinated or only partially vaccinated. And then consider masks optional when you are in low transmission. So this is the recommendation from our state health department. So a few other pieces related to mask requirements. So our state health department, we are required to follow the Strong Schools Toolkit for isolation and quarantine. So when you have a COVID positive case, we have shortened that isolation period that happened right after, just at the first of the year, end of last year. So it shortens that isolation period to 5 days. However, when we want you to wear your mask for an additional 5 days. So 5 days of isolation, 5 days of masking for days 6 through 10. So that means you must continue to wear a mask when you're in school settings, even after when you come back. So you do your isolation. If you test positive, you come back, you must continue to wear a mask for an additional 5 days. If you cannot wear a mask, you must isolate for 10 days. We are anticipating that there will be changes to the quarantine guidance in the state health department, so we're not really touching there because I anticipate that there will be changes in the quarantine guidance not for those that have been exposed to COVID-19. So in summary, just 2 more slides here. I wanted to just kind of package this back together for you. When we started, we had Delta variant, which was much more contagious, 2 times as contagious as the original variant, more deadly, more hospitalizations, more severe illness. We've shifted to Omicron, which is even more contagious than Delta, but the good news is, fewer severe illnesses with Omicron. The recommendation from our state body and our federal partners is still to wear a mask when you're in high transmission. Our case positivity rate is improving. It still remains high. So definitely our metrics for sure are moving down and moving in the right direction. Our case positivity rate also is declining. That is good news. It remains high, but our case positivity rate is trending downwards. Our hospitalizations are still higher than pre-Delta. They are, as I mentioned, over the summer, we had maybe 15, 20 hospitalizations at a time. That shifted up to about 140 in August, and we're just back down to about 101 hospitalizations. So higher than pre-Delta, but maybe just a bit lower than during the Delta surge. Overall, our vaccination coverage has increased. When we had the initial order in place, we were at about 49%. Now we're at about 58%, so not as high as we'd like it to be, but it has improved. At the time, we did not have vaccinations for our 5 to 11-year-olds. We do have those now, so that's the good news. But coverage among that group, that 5 to 17-year-old group, remains relative. Our booster coverage, we'd like to see those numbers go up as well. And those boosters are really is what's going to help us. We do have weekly testing available now in our Cumberland County School District, so every school has weekly testing, and that makes it accessible for our students. At least once a week they have an opportunity to get tested with their parental consent. The testing capacity throughout the country continues to vary depending on the test site. We, for example, have limited supplies of at-home tests, but we have more capacity now for PCR testing. Still limited capacity, I think, in some ways for our rapid tests. We are, again, our 5 to 11-year-olds did become eligible since we wrote the abatement order to become vaccinated. We hope that in the next couple of weeks, we will hear from our CDC and FDA partners about vaccinations for our littlest citizens, for those that are 6 months to 5 years old, that they will also become eligible by, hopefully by the end of the month, beginning of March, and we'll begin vaccinating that last group of individuals. We do have several treatment options in place that are available now with our monoclonal antibody therapy, our antiviral pills. We do know that some of them are in limited supply. We're still, in many ways, prioritizing those. And some of those, that emergency use authorization for some of them has been rescinded because they haven't been found to be effective against Omicron specifically. But we do have some treatment options that are still available to the public that weren't available at the time we wrote the abatement order. Okay, that was a lot of information, and I'm sure there is lots of discussion and questions that the board may have.
Thank you, Dr. Lee. Anyone have any questions for Dr. Commissioner King?
Thank you. Jennifer, thank you for everything you're doing. I know this is a tough spot to be in, but you've proven yourself over the last 2 years you can be tough. All right, I got a couple questions for you. The first one is, everybody says follow the science, look at what's been happening. Everything that I've heard about where Omicron has been, the trajectory is on a similar path, that we would anticipate it to continue to go down. Is that been the history in South Africa and other states? And so we don't know, but the trajectory does show that it will continue to fall.
Yes, so we anticipate that our trends will continue to go down.
Okay. I remember back that there's a policy in place that if you are a masked classroom and somebody comes down with COVID, only that person needs to quarantine.
Only which person?
Or the person who contacted. If you are in a masked classroom.
Yes.
Okay. If you are in an unmasked classroom and someone has COVID, doesn't change things?
It does. And that's what I anticipate that some of that's going to change. They're going to change the quarantine guidance a bit, but what will stand is that if you have COVID, you are going home. But I think I'm anticipating that there will be some changes to the quarantine guidance about whether or not you're in a mask or not, that some of that's going to change in the next couple of days.
Okay, but if on the 16th of February and that hasn't changed and the school board has done what they did, if you're in an unmasked classroom and somebody gets diagnosed with COVID, the entire class has to quarantine?
And so if you are unmasked, so not now, not today, because right now we have a test to stay policy that the state has allowed, which means in a mask required district, and only in mask required districts, if you are exposed in the classroom, then nobody has to go home.
Right.
Only in mask required districts.
Right.
Yes, that's correct.
Okay, I think that's an important thing because there may be some unintended consequences, but, thank you. Now, you've given a lot of numbers out there. How in the world do all of your numbers, and I know these are numbers that you're given, but there's so many home tests out there
Yes.
that you have no idea if they're positive or they're negative or
Yes.
what is, I mean, is there any variable in there or how does that work?
Yes, there is. So some at-home tests report electronically back to the state health department and then back to us. I'd say that's a smaller percentage of the
Okay.
at-home tests. Smaller percentage, because most of the at-home tests, and forgive the analogy here, are like the pregnancy test that you get it and you don't necessarily report your pregnancy test in the health department.
Right.
And so, yes, so it's an undercount of our number of cases because there are at-home tests that we don't have visibility on that also can impact our case positivity rate because those numbers are not in the denominator anymore, if that makes sense. So it shifts that a bit. So it sort of balances a bit. We know there are more cases. We also know there are more tests being performed that are not getting reported.
Right.
So, yeah, yes.
And I think with the availability of tests, people are testing more too, where somebody's
Yes.
testing every day to see if they still have COVID.
Yes, that's true. Yes.
And my last question is, how many other counties took the option that you're aware of to make it a public health mandate as opposed to a governmental mandate? The governmental being an elected body.
That's try not to get too much hard for the week. So some counties made it a Board of Health rule,
Yes.
which they're not necessarily elected, but they're appointed, and they made it a Board of Health rule. So I don't know the exact number off the top of my head, but I'd say there are fewer than 10 of those counties.
Okay.
My understanding is that we are, the public health abatement order that the health director issued, I may be the only one,
Okay.
but there are several other counties that have some ruling in place, whether it's their Board of Health, the county commissioners, or their health director.
Okay.
So a mix of those three. Yes.
Jennifer, thank you again for everything you're doing. I appreciate it all.
Thank you for your questions.
Okay.
Anyone else? Madam Manager, anything?
I don't have anything else at this point.
Any consideration for anything, or?
I do know that Dr. Green and I discussed this, and she has a Board of Health meeting next Tuesday evening.
That's correct.
And she's going to provide the same presentation, or the most updated presentation at that time, at the meeting Tuesday evening. And obviously, this order and this discussion will happen at the Board of Health meeting next Tuesday evening.
Yes, so we're aware and trying to make sure we're taking all of this data and processing it and the progress that we've made so that we can review what's in place.
Madam Chair, can I ask the attorney if there's a legal issue going on here? If the Board of, I mean, where does this all end?
The public health director's abatement order is still in place, it still applies to the school system. And once the school system's order becomes effective, there will be a violation of the public health director's order. I have talked with Dr. Green, we've discussed this a couple of times, and it would really be up to her as to whether or not she would take an enforcement action against the school system. I know she does not want to do that, and I don't think she's going to do that, so I think as she discusses this with her health board next week, or next Tuesday, that she will address it, and I'll have further conversation with her. But right now, she's in a situation of either the school board the school board, this is the largest population of unvaccinated people in the county. So if it's not forced against the school system, there's not very much credibility in not enforcing it at all. So that's kind of the discussion that we've had.
Well, your office is really in charge of enforcement part of all of this anyway,
Yeah,
right?
yes, sir.
Do
Yeah,
you have the capacity to enforce other violations?
I would, they'd have to be reported by the health director. It's the health director's order. Yes, my office would be responsible for doing the enforcement action. And the enforcement action is a civil process in court. The first step in something like this would be an order directed specifically to the Board of Education. It would not be a court action. I don't, with my discussions with Dr. Green, I don't think that is the route.
And when we have, as Mr. Morfield said, when we've had cases, what we operate on a complaint basis. So when we get complaints, people aren't complying, we follow up with them. We try to work with entities. As you've noted in previous meetings, we're not, if you call me and tell me your neighbor is not wearing a mask, that's quite a challenge to enforce. But when we do follow up with businesses on the phone, send a letter, trying to make sure that they are aware of it, making sure they know it's still in place, having those conversations about that. But as Mr. Morfield said, the action is to do a specific order to that entity, and then if they don't comply, to take it to court. Is that accurate?
That's correct.
So if the town of Hope Mills decided that they're not going to go with, they voted and they said, we're not going to do masks anymore, they would still be in violation of the mandate.
But Hope Mills is not doing anything right now. I mean,
No, I understand that, but if they said that if they had...
If Hope Mills adopted a resolution saying we're not going to require masking in Hope Mills, that does not affect the health director's order. It still does not affect the health director's order.
Right, okay. I just want to make clear. Thank you.
Thank you, Dr. Green. Madam Manager?
Yes. Thank you. Item number 3C is a request to waive Ada County Public Library fees for county employees to support the Cumberland County Reads Initiative. We have Faith Phillips with us, our library director, to present this item.
Good afternoon.
Good afternoon, Madam Chairman. How are you? Good afternoon, Commissioners. I'm appearing before you today to request a waiver of the $25 a year out-of-county library card fee for Cumberland County government employees. This request is in support of the Cumberland County Reads Initiative. Cumberland County Reads was developed by the library team to promote reading and professional development to all county employees. This initiative is a way that the library can support our county strategic initiatives of cross-departmental collaboration, recruitment and retention, and professional development for all staff. It also brings awareness of library services and benefits to our community. Over the past 2 fiscal years, the library has collected less than $2,500 per year in total revenue from all out-of-county library cards. The library is a part of the NC Cardinal Consortium, which is a consortium of libraries where we share materials. All but one of our neighboring counties were members. If approved, this program would allow for county employees, regardless of county of residence, to have library cards as a benefit of their employment. The library would then work with other departments to implement sign-up procedures and to work to promote the resources across the county, with emphasis on resources that promote professional development and growth. Your packet has a more detailed explanation of the service, and I'm happy to answer any questions you may have. Thank you for your consideration of this request.
Any questions or comments? Yes. Commissioner Booth.
Seeing none, I move that we waive the out-of-county library card fees for Cumberland County employees to help support the Cumberland County Reads Initiative. And moving on to the consent agenda if it passes.
I didn't hear it all, but I second.
Move to approve what she's asking for.
Yes,
If it goes unanimous, to put it on consent.
All right.
It's been moved and properly seconded by Dr. Council.
Oh, we voted.
I'm sorry, I thought you said you voted.
It's been moved. All in favor?
That is unanimous.
Thank you all.
Madam Manager?
Item 3D is renewal of North Carolina Non-Congregate Sheltering Memorandum of Agreement. Mr. Gene Booth, our Emergency Services Director, has led this effort along with Community Development during the pandemic. Good afternoon, Mr. Booth.
Good afternoon, Commissioner.
Good afternoon.
This item of business is a request to renew the North Carolina Non-Congregate Sheltering Memorandum of Agreement. Cumberland County participates in the Non-Congregate Sheltering Program sponsored by North Carolina Emergency Management. This program is a collaborative effort between state, county, and local partners to provide a safe sheltering and wraparound services for those with no other safe place to go. To quarantine, isolate, or social distance. This is due to COVID-19. This program is for COVID-19 sheltering only and cannot be utilized for primary weather-related sheltering unless a federally declared disaster is in place that includes sheltering as well. Cumberland County has provided shelter for more than 70 citizens and provided transportation to the shelter and to testing sites for about 35. 92% of the services has been provided to at-risk populations who have either been exposed, need quarantine, or have a qualifying medical condition. Cumberland County Emergency Services recommends the following action be placed on the February 21st Board of Commissioner meeting as a consent agenda item, and that is to renew the MOA with North Carolina EM for expedited reimbursement for non-congregate COVID-19 sheltering.
Motion to approve.
Second.
There are no questions? It's been, it's been moved and properly second that this was placed on the renewal of the North Carolina Non-Congregate Shelter Memorandum of Agreement be placed on the February 21st Board of Commissioners meeting. All in favor?
Unanimous.
Madam Manager?
Yes, item 3E is a contract for professional auditing services. This is an item that Vicki mentioned at our last agenda session, and I'll turn it over to her. Thank you.
Thank you, Amy. Good afternoon, Madam Chair and Commissioners. Yes, as I mentioned during the December agenda session meeting, our auditor, Elliot Davis, resigned, and I described that in my memo. So just briefly, we conducted an RFP process. We received 3 bids and reviewed them in 2 different phases. And so the first phase was a consideration of technical qualifications and educational background. So of the 3 packets, we moved 2 forward. The 2 that were moved forward, we reviewed for cost and for audit approach. And we also conducted interviews. And so of those 2 firms, we selected Cherry Becker, who has been a previous auditor for the county. They had the best overall score, as well as the best capacity to provide our audit services. And so that's the firm we're recommending for approval. They were not the lowest bid. They are a nationwide firm with a vast amount of experience with governmental audit contracts, especially in North Carolina. They audit multiple large counties, and they have the staffing capacity to provide the services that are needed for our county. Especially in the area of the federal uniform guidance, which has come to the forefront this year with CARES funding, ARPA funding, ERAP funding, all the federal funding that has been given to the county. They do have a large local government audit team that is solely focused on providing governmental audits. And so in comparison, the other firm, they had no experience working with large counties. They had a much smaller team, and they're still in the process of learning about federal uniform guidance. In addition to that, I also wanted to share that none of the 3 firms responded to the option to work with a local minority firm. So on the cost, for the fiscal year 21, the overall cost was, with Cherry Becker, was $140,600. That includes the general government portion of $125,000, as well as an amount for the FCEDC and the TDA audits. And so the cost difference on the general government audit is a $5,500. It's $5,500 more for Cherry Becker to conduct the annual audit for fiscal year, I said that wrong, fiscal year 22. I'm sorry, the current fiscal year. So that amount includes the audit of 9 single audit programs, so 9 major programs. And as a point of reference, the fiscal year 21 audit had 8 major programs in it. So if the number of programs to be audited were to increase at 10 or above, we would have to have a contract amendment for $4,500 for each additional audit. A point on that is the federal awards allow us to charge the audit fees to the award. And so we conducted an RFP in accordance with federal guidance, and so we're covered there if we have to do that. So that provides my overall summary. I'll answer any questions that you may have.
Any questions for Ms. Evans? Commissioner Bruce?
So, did we get a total of 3, or I missed it, or you narrowed down to 3?
We received 3.
Okay, so
We narrowed to 2.
Commissioner Keith?
I think I'm more concerned with, there's not 3 people. You said one of them was, they're just learning, right?
Learning on the uniform guidance, the federal uniform guidance.
Right. So, they're not even qualified then for us to really do it. If you pick them, you wouldn't be picking a qualified agent, right? It's okay, Vicki. I think the other question is that there's only 2 people going, but we had Cherry Becker for 20 years, and then we almost had to force somebody else, and that didn't work out, and now we're back to Cherry Becker. I'm sorry Glenn's not here, because I know he'd have something to say about it, but is there just not anybody else out doing this?
So what I've heard for probably over the past 5 years as I've attended conferences and heard discussions from the local staff at the local government commission is that auditors are getting out of the business to do governmental audits because it is too much work for too little money.
So nobody else is doing it?
There's firms, but
Except the larger national firm, regional or national firms.
Specialist. The last question is, are we having to pay for 2 audits? When the other team bailed, we didn't pay them, and then we're paying Cherry Becker.
okay, so we'll pay Elliott Davis for the fiscal year 21 audit that they conducted. Cherry Becker will begin with the fiscal year 22 audit.
I thought you said that the 21 audit was not proper.
Okay, so, and that's my next item. And,
Well, they didn't take a vote on this one.
okay.
Make a motion.
We do.
I make the motion that we accept Cherry Becker.
Second. Our fiscal year's ending.
Yeah, I think she's getting ready to.
Yes, sir. So what I'm requesting is for this to be moved forward to consent on February 21st, approval of the 22-12-CTY Professional Audit Services Bid Award to Cherry Becker for fiscal years ending 22, 23, and 24, and approval for the board chairman, the chairperson of the audit committee, and staff to execute the fiscal year 2022 audit contract with Cherry Becker totaling $140,600.
That's what you said. That's exactly what you said.
It's been motion and properly second. All in favor?
Unanimous?
Madam Manager?
Yes, so this is a follow-up item from the January agenda session where Mrs. Evans talked about a reissue of the fiscal year 2021 annual comprehensive financial report.
Thank you. So I'll go straight into the question that you asked about paying for it again. There is no charge again. That contract has been paid in full. It has been corrected. The revised ACFR is now on our website, and I shared the link within the memo of the agenda. And so hopefully you've had a chance to look at that. So what we're doing is seeking approval for the board to accept the audited comprehensive financial report of fiscal year 2021.
Is there a motion?
That's my motion. I move that we, okay.
It's been moved and properly second. All in favor?
Unanimous? Commissioner Key? Thank you. Thank you.
We're going to take about a 5-minute break and then come back in about 5 minutes.
Yes, ma'am. We are on item 3G, This is the formal bid award for the headquarters library boiler replacement, and I'll ask Mr. Walker to present this item.
Good afternoon once again. This is a request to replace the boiler in the headquarters library. The boiler is original to the building, which was constructed in 1984. We solicited bid in December 17th, closed it January 28th, with Hair Plumbing and Mechanical Incorporated being the lowest responsible bidder at a price of $131,000. And so staff is requesting the following actions: that this one be moved forward to the Board of Commissioners meeting as a consent agenda item, and then once the contract has been approved for legal sufficiency, that the chairman be allowed to execute the contract.
Madam Chair, I made that motion that it be moved to the consent agenda, and once approved, that the chairman able to sign the board order.
Mr. Moving properly second, all in favor? Unanimous. Madam Manager.
The next item, 3H, is a proposal for engineering services for the Emergency Watershed Protection Project, better known as the EWP.
So just some quick background for those who are watching, listening. The Emergency Watershed Program is a recovery effort focused on mitigating imminent hazards to life, property caused by natural disasters. Natural disasters that the EWP project that we're focused on is addressing watershed impairments such as debris and clogged waterways, unstable stream banks, and severe erosion jeopardizing public infrastructure. And so the county has selected the Wooten Company from the county's qualifications-based selection list to provide management, consulting, and engineering services for this project. The Wooten Company's fee is billed at an hourly schedule with the cost now, adjusted cost not to exceed $247,500. And we'll make the amendment to the memo and get it to the board. And so the county staff is requesting that this be moved forward to the February 21st, 2022 Board of Commissioners meeting as a consent agenda item, and approve the proposal of the Wooten Companies based on qualifications selection in the amount not to exceed $247,500. And then once the contract has been approved for legal sufficiency, authorize the chairman to execute the contract.
All in favor? Unanimous.
Thank you.
Madam Chairwoman, the next item is 3I, and this is an incentives agreement for Danson's LLC, better known as Project Barbecue, and our county attorney, Mr. Moorfield, will present the revised incentive agreement. We also have Mr. Robert Van Gans with us, President and CEO of SCEDC.
Good afternoon. It's really not a revised agreement. It is the first agreement that the Russell County, the company has agreed to it. The reason that the board approved this back in August of 2020 after public hearing, and the reason I have brought the agreement to you is because the final agreement is a little different again than what was presented back in August. And the basic changes are that the agreement was for 180 jobs, but they're actually only going to be obligated to keep 106 of the jobs for 2 years through August 3rd, 2025. And the incentive grant will be prorated for any jobs less than 106. So that's a step down from what the 180 was. And the investment can be less than 10 million. The investment.
I'm sorry, Rick, I think it's 118, not 180.
Oh, sorry.
Yeah.
I'm sorry. And I didn't have it. It's
118 to 106.
Yes, sir.
90%, yes.
Okay. And then the employee benefits are just stated as health insurance coverage. required to comply, make the company eligible for state tax credits, and this has been sort of consistent with the other ones that have been done. So they are not very significant changes, but they're changes if the board approves that. The company's already approved it, this one will be ready to roll out.
Question?
I'll make a motion to approve.
Second.
That's appropriate, second.
All in favor?
There's two at the door there, I see two hands.
Unanimous. Commissioner
Jimmy.
Thank you.
Item 3J is the closure of H. Getty Avenue and a portion of E. Hahn Street in Moorefield.
This is a road closure, and you used to do about one a year of these, but it's been a while since we've had one. And I'll go over it. Sally, will you be able to get the maps and stuff up on the screen? But this is H. Getty Avenue and a portion of East Home Street. These are two right-of-ways that have never been developed. There are no streets. It's still a wooded area. It's off Middle Road. And I'm trying to get the map so it shows it a whole lot clearer. I have attached, and I have reviewed all the documents attached to this in your package, and that's what's necessary for this to comply with the statutory requirements before you close this. It does comply. And the appropriate resolution for you to adopt is attached. And if I can get these exhibits up on the screen, I'll show you.
Rick, are there any residents on the property on the road?
No, well, there are, the petition that you have has been signed by all the, this petition, it's been signed by all the property owners that adjoin any portion of the two right-of-ways that has to be closed. They're all individuals except one of them is actually, let's see, Christian School. Yeah, but I know they signed it. Let's see what's going on there. Hang on, let's read the next page. Very good, okay. Those are all the property owners requesting this. This is a map of the old subdivision. These two areas that are highlighted are the two areas that be closed. This is Middle Road. All these property owners that are doing all of this, or one person owns several of these lots, but that's why it is. There's still access to the rest of this through here, back up. I think this is 301 back up here, so there's still access to all of this. Actually, the Riverside Christian Academy has most of the front, all of the frontage. So that's, and these, all that there. So all the property owners have requested. DOT, this is what DOT, they have acknowledged that they have never had it in their maintenance system, and that has to be done. This is a map of the same property, except how it's owned instead of how it's subdivided. As you can see, there are a lot fewer owners than lots. This is a GIS map of it. This is the area talking about right here. And this is actually one of the owners that's actually requested. So as you can see, it's never been opened. And none of this back here is developed at all. And we've got an engineer certified description.
You just need a motion to put it on the consent agenda.
The process will be put it on the consent agenda for next meeting. And what that is, you're adopting a resolution that will set a public hearing on March 21st. That will be advertised for anyone to come and speak on this. And that's what we actually take action.
Second.
All in favor?
Unanimous.
All right, thank you.
Madam Manager, are there any other items of business?
No, ma'am. That would bring us into our monthly reports, and staff are prepared to answer any questions that the board may have about our monthly report.
Are there any questions about the monthly
One
reports?
quick one, for health insurance.
Vicki, would you come to the podium?
Is it still maintaining at the same level?
It's still,
the October, November, and December trend has been lower than the July, August, and September. Much lower.
That's good.
But not lower than last year.
Right, we're still.
There's good news. I know.
We're still not
Take
out.
a win, take a win. I know, it's gonna go up.
Yes. That's all we have, Madam Chairwoman.
Okay. May I have a motion to adjourn?
So moved.
Second. It's moved properly second. All in favor?
Unanimous.
Thank you so much.